Doctors in the UK are warning COVID-19 could be linked to a rare but serious illness in children. For more on this, let's bring in Dr. Dyan Hes. She's a pediatrician right here in New York City, and she joins us now to talk about this. So, doctor, what kind of symptoms are these children showing?
So I actually hadn't read this literature. It's not published yet in peer-reviewed journals. So I just read the article that you sent to me this morning. What I could glean from that is that it's an illness called Kawasaki's disease, which is usually seen in children post-inflammatory. So it's like a child has some kind of flu or a viral infection, and then weeks to months later they have this reactive disease called Kawasaki's disease, which attacks the blood vessels of the heart. It's not fatal, is very treatable, and from what I took from this article, not all of the children tested positive for COVID that had the Kawasaki disease. So I'm not surprised, because children who can get a common cold, which is often caused by coronavirus, the non-COVID-19, can get Kawasaki's disease. You can get it after flu. You can get it after multiple viral infections. It's not fatal, and I'm not surprised. I think that what we're learning more and more is that COVID-19 can cause just about any symptom and attack any part of the body, but particularly the vasculature. It causes a lot of inflammation.
Yeah, it's funny that you would bring that up, because my daughter had a Kawasaki disease about 3 years ago, I think. And, we spent a few days in the hospital while she was treated. But you're right, it's not fatal, and she's all fine and dandy, and had to make sure that she got, whatever shot she needed in the year following. But I want to ask you about some new CDC guidelines in terms of symptoms. They added more symptoms, including chills and muscle pains, onto their list. Are we seeing those in children as well?
Personally, I haven't. Like I always say, we're in New York City. We're doing social distancing. We don't have that many COVID positive kids. I just got off of the grand rounds for New York Presbyterian, where I'm affiliated with. The children that we're seeing that have been critically ill have been children who already have been critically ill with either kidney transplant or heart transplant. There are kids who are already immunosuppressed in some way. I'm not surprised that fever, cough, chills, those are all symptoms of a flu-like illness. So to me, adding that to the list of symptoms is a given. Those are all symptoms that you have when you have a flu-like illness. When you have fever, you have chills because your body is shaking and trying to break that fever and dispel that high temperature.
It's interesting that you point that out, doctor, because I thought of that as well when I saw the new CDC update with regards to those symptoms. To me, I would think that for the public at large, it would make more sense to provide some guidance or information to the symptoms that are not common. In other words, for example, when I first heard from our own Dr. John LaPook, he told me something to bring real concern would be, for example, shortness of breath, which you don't normally get with the flu. So I wonder why it's, I guess it's confusing, I think, for the public when you come out with a list like we just showed and you just indicated seems to be very flu-like symptoms, which they say if you have that, you should consider, if you are able to, getting the test for COVID-19. I don't understand why they would just release a list of what sound like generic flu-like symptoms to me.
Maybe the only reason I could think is maybe so we can get more testing done, because if people call, like I know in New York City, you have to call a hotline to get approved for a test. So if you call the hotline and you said, I had a fever of 100.4 and I don't have shortness of breath, they might say you don't qualify for a test. So now if you say I have shaking chills, you might qualify for the test and more people will be tested. I think that might be the reason, but otherwise I can't really see how much more fever and chills are going to bring into the picture, because honestly, right now, like I've said before, I think if a patient has symptoms of high fever, gastrointestinal symptoms, cough, we have to, it's a great mimicker of all illnesses. We have to be thinking of COVID.
Some of the colleges, including Harvard, are really sort of planning to open in September. I'm wondering what advice you would give parents who are concerned about sending their kid off to school.
I think it's too soon to tell right now, because look at this. This started like March 18th. Look how much has changed. Every week we get new guidelines. My guess is that the desks are going to be socially distanced, so maybe people will sit like every 2 desks or every 3 desks. And I think that people will be going back to school with masks on their face, kind of how they're doing in China right now. That's what I think. But I do think that Young people need to be socialized. I think we're seeing, as this progresses, we're seeing more and more anxiety and depression amongst teenagers and children, school-age children. They're really lonely, and they need education. And some schools have knocked it out of the park with the online schooling, and some schools really haven't. And these kids need to learn. I'm worried about their education. I'm worried about kids who have to go to high school who've missed the last semester of 8th grade. I'm worried about kids who have to go to college who've missed the last semester of high school. If their school is not up to par, not every school is created equal. But I do think that if the numbers keep on falling like they are, we will have a new norm, and that we'll go to school probably with a mask on our face and social distancing. Because remember, we're also going to have the flu in the fall. So you're going to have another COVID spike, and you're going to have the flu. So we're going to have to be ultra
What about
careful.
temperature testing?
I think if you can get a thermometer, it's not a bad idea. I don't know how. I've said this before in interviews. The whole point of opening up the economy is getting parents back to work. So to get parents back to work, you need to get people back to school. Once you start temperature testing, I can tell you just in New York City for daycare, they call every parent if a temperature is over 99, and we'll say, the parents will call me and I say, that's a temperature, that's not a fever, right? A fever is 100.5, over 100.4. So who's going to make that decision? Do you send home a kid with a 99? Do you make that parent leave work? So I think we're going to have really strict guidelines about what is a fever to send you home from school, and are there other symptoms with it. And I think people, to be honest, I think teachers and schools are going to be freaking out, so they are going to send home the 99, which we see all the time on regular visits. A temperature of 99 is a temperature. It is not a fever. So I think it's going to be tough.
Doctor, I'm curious about, let's stick on this topic of schools. The President of the United States recently said that he was potentially looking at certain governors easing restrictions across the country, reopening economies, and mentioned schools as one possibility. Given that children can be asymptomatic and can potentially spread it to vulnerable populations, does it make sense? Let's just use New York City as an example, where we've been the epicenter for a good part of this pandemic. I mean, would it make sense to open schools? Understanding, of course, and I've said this, that, in addition to doctors and medical professionals like yourself and essential workers who are conducting themselves heroically, parents too, who are finding themselves becoming teachers at home, becoming IT specialists, becoming chefs, all the things that they now have to do because the children are at home. I get that it's really, really difficult, and I throw the caveat out there, as Anne-Marie knows that I like to do, that I am not a parent, but I am sympathetic to the cause and to what parents are going through. But does it make sense to reopen schools this school year in places like New York City that have been hard hit?
Well, I don't think they're going to open it in New York City. First of all, you've already told people that we're not opening the schools. So people have left New York City. I mean, literally, we have patients that are all over the country. I mean, they haven't really been able to travel internationally, but now you're going to say, okay, we're going to reopen them for June. You have to come back from California or Oregon or wherever you went to be with your family. I think what they're going to have to do is, if they do reopen schools, they're going to have to give parents the option. You can continue online education, or you can come back to school. And I think what's going to happen in New York for sure, New York City, I can say, the volume will be way down because people are going to be petrified to send their kids back to school right now. And also, the public transportation has fallen apart here. We have a huge homelessness problem on the subways. I'm sure you've been reporting about it. It's not really that safe right now because the volume is so low that there's a lot of homeless on the subways. There's much less public transportation, so how are you going to get these kids back and forth to school? And you have to think about the teachers who have to come back. And I think the teachers who are elderly or who have illness have to be given the option that they can stay home and not have to come back, because they're frontliners then. They're putting themselves at risk to teach your kids, but they might have diabetes or cancer or rheumatoid arthritis. So I think for this school season for New York, for sure, it's way too soon to say that they're going to come back, and I think it's going to be optional. I do know that some of my patients' daycare centers have reopened, and it's optional, and they say that they're cleaning the rooms every 2 hours, and it's really to get parents who need to go back into the workforce back to work. I mean, remember, there are parents who are single parents, and if you have a 4-year-old home and you're a single parent and you have to work from home, that's impossible. I mean, because you're a babysitter, a full-time entertainment committee, and you have to work. So for some parents, they really need that childcare in place, and they need to pay their bills.
Yeah. Dr. Hess, all really great points. Thank you so much.
Thank you.